Three exercises that I recommend to my patients with hip pain are the ones I'm about to show you right here. One is a supported hip internal external rotation. So you're sitting down with your hands behind you. You're not sinking in. Your spine's nice and neutral. You're not sticking your chest out. You're just not collapsed. So the back or the side looks like so. So you're not that way. And the back looks like so. Like this. So your neck is not forward. It's just along on the same continuum as your torso. So you're going to be in this position, spread your feet wider than your hips, and you just go down. As you go down, you want your body to not be going forward, so you have that opening of this joint happening, and then you press on the edge of the, in this case, right foot to bring it back up, and then you do the other side. As you start rotating, think about your knees going down in that direction while my torso remains there, so that way I'm opening up that joint. The other exercise is similar to this, only I'm going through the whole rotation now, and I'm going from 90-90, I'm going around into this position and back again. Finally, I love this exercise where you're standing. It's you can use your you can use a chair, you can use your, I don't know if you can use your dining room table, but maybe even I've done this at the arm of my couch where I was supporting. I piled up a bunch of pillows and I'm just doing this, standing there. My hand, I place my hand right here, and I am going to rotate my body up and back, up and back. So I want to have, essentially, you can even use like a bar or something, a chair or something. You want to essentially go through this movement. So you can use a dining room chair if you want to, as long as you can support yourself on one leg and you're holding on. Place your hand here so you feel that movement, and the movement, by the way, is initiated not by the opposite shoulder. The whole trunk revolves around the ball of this bone. So this is a ball and socket joint, and the whole trunk rotates, which is a function of your oblique muscles doing the whole rotation. Typically, we use our shoulders or some other part, not as a group, but as individual sections to signal the rotation around here. And a lot of times the obliques down in the pelvic area don't really perform their job correctly. So the socket, which is the pelvis, sits on the ball, and it does not allow that proper free movement to take place. So by practicing this exercise, you're allowing your obliques to work with the rest of your body and be the initiators of that rotation. In other words, you're training the socket supporters to support the socket in the rotational movement. I love that exercise. Placing your hands on the area really allows your brain to see it, and it's a great one to practice doing. I hope that helped you. Make sure you subscribe, and until next time, take care.